We run our entire company with Zoho, from accounting to HR, loss prevention, document management, everything, pretty much.
We're a tugboat company, and we have about 65 tugboats that are entering their daily traffic within Zoho Creator, and that's how we're using that, and I've been very happy with it. It's an excellent product.
Hi everyone. Today we have with us Dr. Luke, Director of Quality, Risk and Patient Safety, Ms. Clare and Ms. Laurence, Clinical Risk Managers at National Maternity Hospital, Dublin. Also known as the Hollis Street Hospital, NMH is the largest maternity hospital in Ireland.
Thank you. Doing well, thank you. Yourself?
I'm doing fine, thank you. So briefly, what does your job role entail at NMH? What do you guys do?
Well, I guess I'll start. My role is I have overall responsibility for the management of quality, risk and patient safety in our hospital here. And I'm very fortunate to work with two most excellent teams, one of which is two members here from the Clinical Risk and Legal Department. And then I also work with the quality team.
Yeah.
Right?
My background is midwifery and nursing, and I'm now a clinical risk manager for the last 3 years. The role is varied. You deal with incidents that happen in the hospital, you attend meetings, you have an educational role to staff and to students. So it's very varied. Every day is very different. So, yeah.
And I, like Laurence, my background is midwifery and nursing, and the role, as Laurence says, it's very diverse and very varied. We would also work with staff in identifying risks and how they're controlling and managing the risks. And we also would deal to a certain degree with the coroner's court. And the role from the length of time I've been in it has really changed and it has grown. And as Laurence said, we work with staff education. We also do education sessions outside of the hospital with the other maternity hospitals.
So I think there's a very protective coverage. So how is NMH handling the coronavirus pandemic?
Well, it's been handling it pretty well. Very quickly, a lot of restrictions were put in place in Ireland, but in Hollis Street, visiting was restricted. Our role, we separated ourselves because we're 6 in the office. So we separated ourselves into 2 teams, like that if one team member got sick and the team had to go off sick, there was still a team that could function and keep going with the job. And the same in the hospital, people they adapted very quickly. There was an awful lot of restriction that started to ease a little bit, but there's still restriction. And the fact that people had to wear this kind of visor, it's the kind of thing that you get used to it very slowly, but it is a difficult thing because as humans we're trying to congregate together, so it is difficult. But, yeah.
Because there was so much going on when the coronavirus hit, we decided as a department that we would leverage the abilities of Zoho Creator, and we built what we call our COVID-19 app. And in this app, it allowed us to track each and every individual response by the hospital to the COVID-19 pandemic, and then allowed us to produce reports at the click of a button when different agencies external to our hospital were asking us what are we doing in response to COVID-19. As well, of course, internally, task forces were set up that it would provide ease of access to information and insight as to what was being done in response. And additionally, with the way we designed our little app, it is by no means complex at all, but it allowed us to add updates as well so that we could provide information to the leadership and management of the hospital, as well as our external regulatory agencies, what we have done and what was improved as we went along as well. And that has become a very important information management tool for us as we, continue in the pandemic and maybe come out the other end and reflect back on what we did well and maybe what we didn't do so well, so that potentially, I hope they never happen again, but for future pandemics, we will be in better shape.
Since you're healthcare professional and you did talk about the COVID app, which means that you're really enthusiastic about technology. How do you think low-code technology can help others in the healthcare industry?
Well, I guess I can start off the answer to that. We had been looking for, I'm here nearly 5.5, 6 years. We had been looking during that time for a solution that could get the balance right between our ability to configure, maintain and update the platform, as well as, of course, the data and analyze the data within the platform. We started off with using maybe Microsoft Office tools. Then we progressed that we found a fat client database application via the internet. We implemented that initially, and that was definitely an improvement, and it began to change our processes. And then about 2 years ago, after continuing searches on a regular basis, we happened upon Zoho Creator, and we very quickly realized that its low-code capabilities meant that we could be almost self-sufficient within the department. It was cloud-based, it was easy to use. There is far more functionality in there than we're probably using at the moment, so we're learning as we go along. But what we found with it is that it didn't just mean that I had a background in IT. It's a few years ago since I was in direct IT. But as we began to learn it and use it, we also found that at this stage, Clare and Laurence, who are obviously from a clinical background and not an IT background, they have the capabilities to go in, not necessarily to initially build the apps, but they're certainly in good shape with the user interface to go in and make changes and to reconfigure reports and everything like that. How did you guys find it?
Well, Clare first, because Clare, you were the first to use.
I found it really, really good, and I think, as Luke was saying as well, it's simple to use and much easier now than the systems we've used before, and it's not as labour intensive as our paper-based days when we were using Word documents. But it's very easy to use. I like it. It gets reports quickly at the press of a button, and even showing others and the staff how to do it. I can manage that much, which is a lot with my not so good IT.
Yeah, but I had never used the system, the previous system before. I came to an already-made system, the dorms, and it was great for what it was, but this system is so easier. You don't actually need to have your desktop from work. You can use it on your phone. You can use it with a tablet. So, and everything is available. So it's really good. And the fact that you can access what you want in the cloud and you can run reports. And the fact also that we can ask, because Luke's background is IT, so we can ask him what we want, what we need to show to the others. And it's just fantastic. It's good.
And the data we're getting as well is live. It's up to date. Yeah. It's not saved from last week or last month. And that's really, really important too.
Yeah.
I think as well, Sarika, what we have learned is the acceleration capabilities of our use of Zoho Creator to change the way that we provide our services. Originally, we were of the view that that the use of IT could enable us to do a better job. But in actual fact, we've discovered that it actually accelerates our ability to do a job. And we learned that because we discovered that we needed to change our processes, not just simply implement, in this case, a low-code solution. So what Zoho has facilitated indirectly is for us to sit back and review how are we doing our business and how can we accelerate the way we do our business by implementing Zoho Creator. And we have now arrived at a process that if we identify a solution could be provided for data management through a Zoho app in our hospital, we always ask the first question, which Claire alluded to, which is, what do you want to get out of this? As Stephen Covey, the famous business writer, said, we begin with the end in mind. So anytime we sit down with a member of staff, one of our colleagues, who is interested in using an app and building an app, that's the question. What do you want to get out of it? And then we work back from that through a process that has evolved over the last year, 18 months.
So I wanted to ask, during the initial stages, especially for Clare and Laurence, because you guys are not from the IT background, was adopting low-code difficult for you as well as the other staff?
Well, for us,
Adopting it.
yeah.
It wasn't. It was made very easy. And I think as well the fact that Luke had the experience, the IT experience, we could work with him. And like you were saying, what we wanted to get out of it could go in at the beginning. But I came from paper-based where it was Word and it was Excel. The next stage then was an improvement on that. But this, because it is cloud-based and because it is user-friendly, and the changes can be made very, very easy from our point of view. I mean, to me, it's a dream come true, in how easy it is to use.
Yeah.
With the we do have the expertise here, that makes it a lot easier as well.
And it's being built especially for our needs. And once you're shown how to use it, it's really easy. It's really good.
Even we can manage a certain
Yeah.
I think you've hit on a key point there. I think one learning for me is that we are building our apps using Zoho Creator. They're built by healthcare professionals for healthcare professionals.
Mm-hmm.
So they're built on experiential need rather than we bring in an external contractor. And the first thing is we've got to try and get them to understand how we work. Why we work that way and the environment in which we work. So we've been fortunate in that regard that Zoho Creator in its design as a low-code platform allows us to configure our own apps. And that's really important. And I think that's one of the critical success factors for us has been that this is apps which are developed by healthcare professionals for healthcare professionals.
And also on that, it saves a huge amount of time. We don't have to go back and forth to another department or an external agency, and that's huge as well. Also, as Luke was saying, we can update it and it stays reviewed and updated regularly, and that's easier to do as well. And that's really important, particularly if we're running reports that, we need different data that maybe have been requested. But, it's much, it's a simpler process. It could be complicated, but it's simpler for us.
It's also provided because we publish our data analysis reports, the pivot tables or the graphical format. We publish them on our secure intranet. It has become a self-service portal, if you will, for staff themselves to go in and get their own reports. So rather than historically they would have contacted our department across quality risk and patient safety and say, we need a report for this, that, and the other, and we would have to go do it. Now they just do it themselves.
Specifically, what was the need for you to choose a low-code player like Zoho Creator? What was the problem statement that made you choose Zoho Creator?
Oh, I'm not convinced that it was a particular problem statement that we had. Are fortunate to work with colleagues who year on year are looking to improve how we provide quality risk and patient safety services. And as a result of that, we have the principle that no matter how good something might be at the moment, we can always find ways to improve it. So we had started off with, very little technology in the process. And then as we evolved through using traditional office products, through a specific database, through to Zoho, and since we implemented Zoho Creator for our low-code apps, we're still continually evolving. We learn almost on a daily basis something new about what Zoho can do. So it's just a continuing evolution for principle, which is a fundamental principle to quality, risk, and patient safety, not just low-code apps, and that is continuous quality improvement.
So you did tell me that there was a previous technology. So what was the technology, and was it a particular reason to choose Zoho Creator over the previous technology?
It's just we have a lot of data that we need to use every day and we need to access every day. And for patient safety, for example, a very simple example, if an clinical incident happens, and you are in a setting when you are reviewing the incident, everybody in the room reviewing the incident needs to see the data. And so it's something that it's easier to show if you use a local technology. And also for a department, if they need to run reports, they will have the reports in no time, So everything is built to facilitate the access of data, analyzing of data. So,
yeah, we're getting to the stage now as well where staff are actually logging themselves, as Laurence was saying, clinical incidents, and they're doing that themselves now, so they're becoming more independent in that role. But I've come from, and I know I've said it before about the paper base, and I've come through the process, and this is so advanced and so much easier and user friendly than previously when we were at meetings with, the papers. Whereas now at our instance meetings, it can all be updated live there and then, and that in itself is very useful as well.
I think simply it's a strategic fit for what we wanted. I mean, back 5 years ago when we began our journey to find a platform to accelerate our ability to provide quality, risk, and patient safety services, it was always in our mind. We even then, maybe not knowingly, but we were beginning with the end in mind, and that was to allow the building of an environment which was secure, it was permission controlled, and it was distributed so that multi-users could have multi-simultaneous access to the same data, to update the same data. And it took us, 4.5 years to find a platform that would allow us to do that in a manner that was easy to do and that we could have our own autonomy in the build, support and maintenance and evolution of our apps. And that's what Zoho Creator provided for us.
And I think as well, having our own autonomy is huge. It means we can develop it for our needs and what we want to get out of it, or what the staff need to get out of it in whatever app they're using.
Yeah, I mean, once again, it's built by healthcare professionals for healthcare professionals.
So NMH uses apps like clinical risk management app, the patient feedback app, compliance app, the quality improvement app. So can you tell me, in a brief terms, what do each of these apps do? How do they help it?
The instant management apps that we're using at the minute, it's the instances are logged on a daily basis. They are, when we have our review meeting, they are updated and closed out, or if there's further actions taken. We can get our data from that app very easily for medication safety meeting. The risk management meeting, our app is the app where we have identification of the risks, but the risk owners are responsible for that. They log on their risks. We facilitate sessions with them. Some of the departments are independent in that, and more of them, they just like us to do sessions with them. They find it easier. But they have embraced that because they find it easier to use, and certainly easier to use than the paper base that we were using previously.
The data is in the cloud, so you don't need to retrieve, to go to meetings with big folders. Everything is in the cloud, and once you have a screen or you have something that you can show, it's there. It's easy to use for us, but it's also easy to use for the staff that have access to the data, and they can enter themselves, they can review themselves. So it is really, really good for that.
And the feedback has been very positive
Yeah.
from staff, and that's what we want, is for them to be more autonomous and more independent in their management of the systems.
And it's secure. It's going to eliminate a lot of the paper trail, and because it's very expensive, the paper trail, you just have to file them, and then you have to send them off-site, and then you have to keep them off-site, you have to bring them back, while this is just there. At the click of a button, you have your data.
The additional apps that we have begun building as our colleagues around the hospital started accessing the incident management apps and the risk management apps that Clare and Laurence alluded to. We now have a number of specific departmental apps which are providing data management and analysis services for those departments. For example, we have an app for fetal medicine management. We have an app for infection control and management. We have an app for specific clinics providing, post-delivery services and assisted care. And also on a corporate side, we recently evolved our risk management app to include the management of corporate risks. Also, we have a compliance management app that our compliance officer uses to manage compliance. We have a DP and GDPR app that allows electronic reporting of any suspected, potential or actual data breaches. And one app that we're particularly proud of is feedback management app for our patients, because this allows our patients, we publish the form through in an appropriate, secure, permission-controlled manner on our website, and our patients just go to our website to give us feedback. That automatically populates the patient feedback management system, and then when our patient advocacy officers and quality manager logs in, they can then go in and manage the feedback thereafter, depending on its nature. And we have aligned it with the management requirements from our regulators as well. So we really have a wide range of apps, and we're always looking to see if there is an app there that can help. And only in the last 2 weeks, our latest app that we developed, we're calling our strategy manager. And our strategy manager, we've recently developed a new 5-year strategy for the hospital, and we have set up a strategy app which is accessed by the 5 strands or goals of the strategy, have an appointed leader, and they each have their own site within our strategy manager app to go in and to identify objectives and to link objectives to evaluation of objectives and to identify the type of evaluation approaches, measures, metrics, KPIs, and we all of that now in an app so that our senior management, our board, can go in and see how we are progressing with the implementation of our strategy. Maybe 16 or 17 at this time?
16 at the time, yeah.
So how long does it take to deploy each of these apps?
Well, it really depends on the app. And I don't think we could say that there's a deployment and then deployment finishes and they start using the app, because we're constantly evolving the app. And one thing we've certainly learned is that our process facilitates that sometimes our users don't fully understand what they need in an app and how they need to have workflow, dependencies, interdependencies, until they actually start using it. But I would say that usually it's a month to 2 months between the first conversation about what they want through user acceptance testing, and then a little bit of back and forth of tweaking until it's right.
The apps are continually updated as need be. Like, we're going to review our app. We do it at the end of every year, beginning of the year, and any time in between where, as Luke was saying, a need might arise that we need more information, or just in the whole process of how we're doing things, another step would be more beneficial. It's so easy to do that. Well, with Luke, it's so easy to do that because the expertise is here.
So how many users do you use that?
How many users? Do we get?
Well, our approach, because we're publishing the apps on our secure internal intranet, some apps are published so that users don't need specific accounts, that they can log on and go on to a specific section of our intranet, and then they can leverage use of the app. In other words, we might publish a baseline pivot chart or graphical interface so that they can then go in and drill down. That doesn't require a user account per se. But people who are actually using or leveraging the power of the app, you could argue it's nearly the whole of the hospital, all departments, all staff. But particular app users, people who have responsibility for their own app, at the moment we probably have around about 30 to 40.
Yeah, they're 40-something departments. So
But we have the potential, but we're being careful, we're being strategic. We have the potential to go up to 101 registered users, but the way that we're rolling it out to make it a self-service reporting portal allows us to publish graphs and such like data analysis on our intranet.
So, in your opinion, what are the benefits that Zoho Creator has provided for in terms of efficiency? Going
The benefits of Zoho Creator.
Oh gosh, where to start? The benefits of Zoho. Well, as I said before, having come from when we were doing things paper-based and labour-intensive, it's an easy system to use. It's one that the different departments can take ownership of their own data and logging their risks, and we even have one of the departments logging their own instances. We get the data out at the click of a button. We can update it as much as we need to get what we need out of it, and that's really important.
Accessibility.
Yeah, accessibility. Because, and it's also because the information we're getting from it is completely up to date. It's not a week old, it's not a month old, it's not even a day old. That's hugely important as well. It's up to date.
You can load data straight away. You can actually, if you want to attend a meeting, and if you have a laptop, you can actually open it and show what you need to show then and then. So it's cloud-based, it's safe. You can use it at home, or on your mobile, or you can use it on your own laptop. So once you have permission to use it, it's fantastic.
I think to summarize some of the key benefits, we can look at what our journey has been. We've gone from paper to paper light to paperless. And whilst there were other platforms and technologies along that journey, undoubtedly the use of Zoho Creator has significantly accelerated our ability to be paperless. And it's only going to increase next year as we begin to shift more and more departments from kind of using an interim paper-like solution to completely paperless. And then when you consider, which is something that Clare and Laurence alluded to, the international definitions from the International Organization Standards for Information Security, it talks about the triad, which is confidentiality, integrity, and availability. And that's something that we find, excellent with our use of Zoho Creator, is keeping very sensitive data confidential. We're providing an excellent cloud-based, secure, permission-controlled environment for us. From an integrity point of view, again, supported by our learning and use of the product, it's making sure that our data is reliable, it's valid, because we're making a lot of key decisions on healthcare based on this data. And as both Laurence and Claire said, its availability is terrific, because we don't have to be on the hospital network at all to access, and if any of us are away, we can be contacted and we can go in via our mobile device or our laptop, or indeed a desktop at home.
So Zoho Creator has helped NMH go digital, and reduce the labor-intensive processes. Apart from the strategy manager apps, which is recent, are there any other developments in the pipeline?
We will certainly, year on year, as Claire alluded to, we seek to continually improve some of our core apps. So certainly for 2021, we have one section of incident management that can go paperless, so we will be facilitating that. As to new apps, I think we work in an industry where suddenly, new ideas emerge. So I think maybe it might be best to describe, Sarika, that our plans are very much emergent, and that's another beauty of Zoho Creator, that it allows us to do that. I can tell you that the production line at the moment, we have an app almost ready to go live, which is going to contribute to the management of infection control in our hospital, particularly looking at urinary catheter infections and management. Then on the next in the production line will be a health and safety management app, which we will be working closely with our health and safety manager here, which will provide a multifaceted approach to the management of staff health and safety, including I think it's almost become self-fulfilling, Sarika. I think that as we learn more and we develop valuable apps or evolve existing apps, other people see it and think, well, wow, what can I use it for? And then suddenly we're sitting down in a meeting with these people and beginning with the end in mind and asking them, what do you want to get out of it? And, a couple of months later, they have their app up and running depending on the complexity of their requirements.
And they're happy.
And they're happy. It is secure. We are autonomous in our ability to use it because the interface makes it easy to design and develop apps. The ability to produce graphical interfaces to allow data analysis through drill downs is particularly good for us, and we're constantly using that in our reports. So ultimately, the key benefit is understanding that it's helping us to accelerate the processes that we have to improve the services that the Quality, Risk and Patient Safety Department need to provide to the hospital, and of course its key interested party, our patients.
And I think as well what has made it easier is the fact that staff like it and they have embraced it like they haven't embraced any of the other previous systems. So that's hugely beneficial too.
And we're hoping in the long run, as to give you a simple example, in the long run, we're hoping that all staff will report, for example, incidents just online. So there'll be no paper trail, there'll be no paper going into envelope to our office or left into a cupboard, into a ward. So it will be very secure. So that's in the pipeline too. We're started already. We've piloted some areas. So that's one thing.
So thanks a lot for sharing how NMS uses Zoho Creator. Thanks a lot.
Thank you.
Thank you.
All righty, thank you, Sarika, and keep safe.
Thank you.
Sure.
Thank you.
Bye-bye.
Bye-bye.